Hello, my name is Mary. I'm a senior wellbeing practitioner and I work with the MHST team here in the New Forest.
Hi, I'm Mia. I'm a primary mental health worker and I also work for Hampshire CAMHS. And in this video today, we want to give a brief overview of the risk factors that can cause emotionally based school avoidance. What does it mean and what does it look like? So just as with general mental health, there have been factors identified that place children and young people at greater risk of EBSA. It is usually a combination of predisposing factors which interact with a change in circumstances, and that can lead to a pattern of behaviour that's described as EBSA. The predisposing factors may be present in the nature of the school, the child's family, or the child themselves. And we're going to touch upon those in more detail. So we're going to break them down into those three categories. So we're going to explore school factors, we're going to think about what some of those family factors might be, and then we'll think about the child or young person and those contributing factors.
If we think about school factors that are many, such as bullying, exam pressures, difficulties with schoolwork and expectation. If we think about transport to and from school, and then obviously peer pressure and transitioning from lesson to lesson. So family factors can have a big impact, but it's important not to blame parents. These are not your fault. But children can pick up on these things happening at home. So for examples, worried about parent, especially when it comes to health, leaving them at home. They may be a young carer. Family breakdowns, for example, separation and divorce and family stresses. Difficulties in family environments, dysfunctional family interactions. Bereavement, redundancies and other siblings. Being the youngest as well. Then if there's a history at EBSA in the family and that difficulty going to school.
There are also factors that may be present in the child or young person, which you'll have a think about. But it's important to remember that every child is different, so they will react in different ways. But we can think about their temperament style. Are they withdrawn? Also think about their age that might place them at risk of developing EBSA. They might have learning difficulties as well. It's also important to think about, have they got their own needs? Physical disabilities, medical disabilities. There might be some big events going on, maybe moving house or school. Physical illness, but they may have some anxieties. They might be low in confidence, fear of failure or fear of getting into trouble. A massive factor about school as well is a sense of belonging. And if they're experiencing difficulties with friendships or bullying, that can also be very difficult.
So, push and pull factors. Push factors, for example, those that push the child towards attending school. And then the pull factors, for example, those that pull the child away from attending school. The literature indicates that EBSA is most likely to occur when the risks are greater than resilience, when stress and anxiety exceed support, and when the pull factors that promote school avoidance overwhelm the push factors that encourage the school attendance. It can be helpful for separating out what changes might need to happen at home and in the school environment.
So it's also important that we think about our students that might be experiencing neurodiversity or be diagnosed with neurodiversity. So if we think of the neurodiversity umbrella and what this means to the young people when it comes to challenges of attending school, it's really important that we have to think about some of these factors. Neurodiversity is not a mental health concern, but neurodiverse children and young people are more at risk of mental health concerns, such as anxiety and low mood, which can result in EBSA. And a better understanding of what makes things difficult for them and how they can be supported in a school environment is paramount to the young person being brave enough to attend school.
If we think about challenges in the school environment, especially with our neurodiverse young people, think about the map of the school and be mindful of those sensory difficulties that would impact school attendance. Examples such as noise, lots of students and staff, changes in classroom, and then different teachers with different rules and routines can be very tricky. The smells, for example, canteen, the other students and teachers around them, and what is around them, overwhelming feelings, expectations and socialising. If we think about the school uniform and difficulties with textures, feelings of clothes and footwear, this can be very challenging for a neurodiverse young person. They often mask those thoughts, emotions and behaviours, which will often result in meltdowns at home. It's incredibly tiring and exhausting for them.
And when we're thinking about some of these difficulties, it can be helpful as a parent and carer to think about how we can support the young person at home. And it's really important to think about what happens straight after school. Maybe you might like to think about a toolbox or a bag or a soothing box prepared that can include lots of different things to support those sensory needs to help them feel able to relax, chill out at home, and help prevent burnout. And there is a video on our website around creating a self-soothe box, which you may wish to check out. And research reports that there is an increase in neurodiverse young people with EBSA, so it is really important that we help support them during this time.
We hope you have found this video useful. This is part of 3 videos, so please go and look on the CAMHS website for the other 2 videos that also talks about EBSA. Thank you.